Hi, I'm Dr. Mariam Yasmin and I'm going to talk about obsessive compulsive disorder, history and counseling for NAC OSCE. This video is for educational purpose only. The outline includes case history, counseling, treatment plan, and at the end I will touch on common obsessions as patients can have different presentations, and we'll also discuss different conditions that can be related with OCD. So we have a case here. A 45 years old male patient is here in your clinic with his wife about a concern that he has rashes on his hands. Take a detailed history and address his concerns in 8 minutes. So the first thing is introduction. Always start by introducing yourself. Ask the patient how they would like to be addressed and ask an open-ended question. For example, how can I help you today? Then start taking history and again start with an open-ended question that what is your wife concern? What does he think about it? And the next questions will be related to onset, course, duration, and the history of the condition. So O is for onset, C is for course, D is for duration, and B is to ask that has this ever happened before? So you can ask these questions by asking, when did it start? Do you think that it is getting worse? How long you have been experiencing these symptoms? And has this ever happened before? So after ruling out OCDB, then we will ask the questions related to obsessive compulsive disorder condition. So you can ask the questions like, do you feel that these thoughts being implanted from outside? How do you feel once finished the activity? And the activity will be washing hands in this case. That is why the patient is having rashes on his hands. Next question will be, do you feel that you cannot stop these thoughts? Ask about precipitating factors. There can be precipitating factors that has manifested in this way in this patient. So ask them about any significant event that brought change in their life, like job loss, personal loss, or broken relationship. Ask question that do you feel like that all the time or at a specific time? How does it affect you, your family life and work life? Are you preoccupied with any thoughts like worrying about perfection, any religious thoughts? Also ask them about that apart from washing hands and checking door lock, do you have any other compulsive things that you feel like doing? For example, any repetitive movements, counting repeatedly, turning off the stoves, taking bath or brushing. So these are all the questions related to obsessive compulsive disorder. After asking the condition specific question, then we will ask about the questions about the other psychiatric conditions. And for that, we have a mnemonics that is MOPS. M is for mood changes. And we usually divide mood changes into two categories, that is high mood, that's mania, and the low mood, that is depression. So you can rule out depression by asking that, how's your mood? And another question that we can ask to rule out depression is that have you lost interest in the things which you used to enjoy before? And for high mood, then you can ask that is there any time when you feel high? Then rule out the organic causes, which can be drugs or any medications. A is for anxiety, and you can rule out anxiety by asking question, are you a kind of person who worries a lot? P is for psychosis. So to rule out psychosis, you can ask a question, do you see or hear things which others don't? And S is for suicide. So to rule out suicide, you can ask them about any suicidal thoughts or do they have any thoughts to harm anyone else around them? Then ask them about any life-threatening trauma. Maybe these symptoms can be a manifestation of any post-traumatic stress disorder. Ask them about panic attacks and also about certain situations in which they can be afraid. At the end, check the insight of the patient. Checking insight is very important in all the psychiatric cases. So you can check insight by asking, do you feel these obsessions are not real? Do you think these obsessions may be a manifestation of any underlying medical condition that needs to be treated? So after checking the insight of the patient, the next step is counseling. Start counseling by saying, thank you for answering my questions. From what you told me, it looks like that you have a condition called OCD. Have you ever heard of this condition before? And if the patient says yes, then ask them how much they know about the condition. And after that, explain them what obsessive compulsive disorder means. In that case, you can say, you have a condition called OCD, obsessive compulsive disorder, in which unwanted thoughts, images, or behavior will be followed by certain repetitive activities which relieves the anxiety. In your case, you are worried about the germs and burglars and checking repeatedly, door knocks and washing hands, which relieves your anxiety. It is a chronic condition but has a very good prognosis with talk therapy and some medications. During counseling, after every 1 to 2 minutes, stop and ask the patient if the patient is following you and if he's getting the idea. Always ask the patient if he or she has any question. And once the patient is clear with the idea of OCD and he doesn't have any questions, so you can move on to discuss the treatment plan with the patient. So there are the two treatment options available for OCD. The one is cognitive behavior therapy, and the second one are the medications. And in medications, we have SSRIs, the medication which we use for the treatment of depression. But in OCD, we need higher doses and a long treatment time. Another medication that can be used for the treatment of OCD is TCA, that is clomipramine. And in counseling, then explain to patient that what a CBT is, and for that you need to make a referral to a psychotherapist. And who are the psychotherapists? They are the trained professionals and they will provide the CBT to the patient. Regarding drugs, when you prescribe any medication to the patient, always explain the side effects of the medication. Tell them that when you will start them on SSRIs, the initial 1 to 2 weeks, they may feel worse. And during that time, if they ever feel any thought of hurting themselves or hurting anyone around them, they need to call 911 immediately. Tell them that try to be someone around in those 1 to 2 weeks. These medications take some time to kick in the system. So once they kick in the system, they will start feeling better by 4 to 5 weeks. And they have to take this medication for a longer period of time. They cannot stop this medication all of a sudden without the doctor's advice. They may feel better after taking it, but they have to take it for a long period of time in order to prevent the relapse of the condition. Always ask the patient if they are understanding what you are explaining to them, and always ask them for the questions after every 1 to 2 minutes. And once you are done with the counseling, tell them that you can refer them to the psychiatrist, start them on the medication, and book a follow-up appointment with them in time period of 2 weeks to see that how they are doing on the treatment. Offer them brochures and online resources so that they can read on their condition on their own. And that's how you will complete this case. At the end, I would like to discuss about some common obsessions which the patient can present: contamination fear, pathological doubts, somatic dysfunctions, need for symmetry, and hypersexual drive. And for these obsessions, the common compulsions are checking, washing, counting, need to ask, precision, and hoarding are the rituals served to counteract the anxiety induced by the obsessive thoughts. There are certain conditions that can be related with OCD, and they are body dysmorphic disorder. Body dysmorphic disorder means that patient has a preoccupation with more than one perceived flaws in physical appearance not observed by others. Another condition that can be related with OCD is hoarding disorder, in which there is a persistent difficulty in discarding possessions regardless of actual value, feels the need to save items, and discarding create distress for the patient. And the third condition that can be related with OCD is excoriation, that is a skin picking disorder. Patients, they recurrent pink skin picking result in lesions, repeated at attempts to stop or decrease skin picking. And that's complete our today's discussion about obsessive compulsive disorder. Thank you.